Ladies and gentlemen, I wish you a constructive and interesting discussion, new insights and good processes.
The Seventh EDCTP Forum really aims at showcasing the results of the first program of EDCTP, what has been done in terms of research, capacity development and networking. We are celebrating the 10th anniversary of EDCTP, and this is a time to reflect on the journey that we've traveled right from the establishment of the program in 2003.
We have a model to strengthen the health of everyone, not only for the 3 diseases and the neglected, but a real global health perspective.
So everybody has come together at this forum, shared the vision of what EDCTP is about, is to build capacity and to really make scientific breakthroughs in African health problems. And so one really gets the sense of a shared commitment and goal at this meeting of all the EDCTP partners.
A lot of people are here from different countries, different backgrounds. We are able to interact, we are able to build networks, we are able to exchange ideas, we are able to network. That is the major thing, and also keep abreast with what is currently happening, be it in HIV, in TB, in malaria, or in health research issues or regulatory issues.
The program has really done great work, especially in Africa. The core focus of the program is on developing new interventions through clinical trials, and there have been studies that have really delivered on this.
I've been working on big trials in Africa since the late 1990s, and particularly those answering questions that are very practical for paediatricians on the ground, people looking after children with HIV. The focus for the CHAPAS trials has been really looking at the simpler generic formulations, and EDCTP contributed enormously to this trial. Really, they funded the trial and they funded an awful lot of work around it. We've got an incredibly rich data set to do further analyses. So that's one. The second was all the PhD students we had. The EDCTP funding brings that additional training aspect, which I think increasingly we appreciate is absolutely vital to future leaders in Africa.
So the EARNEST trial was a collaboration between various European institutions and 5 African countries, and it was designed to address the question of what's the best second-line regimen for the treatment of HIV. Having EDCTP backing of the trial has really given a much more holistic product. At the end of the day, we've delivered a first-class trial, but we've also made sure that the right things are taken care of in terms of training African investigators and spreading the networking and the knowledge alongside that.
Right now, for me to be here would help me understand on where exactly we are in developing these different TB diagnostic tests, if we are indeed winning the battle.
A lot of Africans are going to be trained, and will improve the capacity of Africa to do research that is relevant for Africans.
In Africa in general, there has been poor training at postgraduate level in life sciences. So we train people at master's and PhD level. And we have had a very good relationship with industry and the universities in Africa.
The West African region is one of the most disease-burdened regions in the whole world. So we are really interested in seeing the cutting-edge research that's coming out. The research environment in Africa has improved tremendously since 2003. So the coming in of EDCP2 is to enable us to move to even a higher standards. I look forward for a day where we don't have to send any samples to Europe, to America to do complicated analysis, but we'll do it in Africa.
I think there's been a lot of capacity building in EDCTP1, and that capacity can now come to fruition where people can bring their own new AI innovative ideas and make it absolutely sure, sustainable, and get the younger generation that's now coming into research in Africa into those programs.
EDCTP2, this is the new program that is to be funded as part of Horizon 2020, which is the new funding instrument from the European Union, with co-financing coming from the member states. And this is exciting that it is bringing together European participating states and African participating states.
Well, I think that the good point from EDCTP1 to EDCTP2 is the fact that now African countries are full members of the EDCTP association.
EDCTP2 should bring greater engagement with the researchers, should bring greater engagement with the governments, should bring greater engagement with patients, should improve clinical trials and clinical trials management. And for us as a West African Health Organization, we are looking at bringing all our 15 country members on board onto the EDCTP2 program.
EDCTP2 is an ambitious program, but we need to be ambitious as Europe and Africa have a collective responsibility to address the challenge of today and find sustained solutions to address poverty and its diseases. EDCTP is an important partnership to this end.
Almost all the presentations were coming from young, African, confident presenters. 5 years from now, how many leaders are we going to have working with EDCTP? Thank you very much, all our presenters.